Welcome to the ITM Congress highlights of EANM 2024. My name is Herrmann. I'm a nuclear medicine physician based in Essen, Germany, and together with my fantastic co-moderator, Professor Karolien Goffin, Professor for Nuclear Medicine in Leuven, Belgium, we are going to discuss with you all the important things about the EANM 2024. And I'm going to hand over to you, Karolien, to tell our listeners a little bit about the format of the ITM EANM Congress highlights.
So during the next 4 days, we will, on the one hand, look back at what great science has been presented during the day. We will discuss between the two of us what we liked, what we didn't like, what was really great, what is maybe practice changing. And then we will also look forward to the next day and give you some insights on what we believe are really the highlights lectures for the next day.
So EANM comes back to Hamburg after, I think, exactly 9 years. Last time we were here in 2015. You can see the Congress Center is beautiful as never before. And we are now actually expecting more than 8,000 participants. As not every one of us can follow all the different parts of this Congress, I want to just quickly mention that there are 4 plenary sessions, including one finally closure session. And I personally am going to cover the first 2 plenary sessions, telling you today the big opening is the highlight lecture. There are 3 speakers, Wolfgang Watzak, Annette Petrec and Daniela Oprealaga, summarizing all the important things about oncology, medical physics, radiochemistry, but also inflammation as well as neurology. And then tomorrow, a very important plenary, dear to my heart, because it's a topic of theranostics come of age. And we are actually hearing 2 things about that. First of all, how we can really bring theranostics centers to the forefront, implement more theranostics centers. And the second part, we're going to hear about all the clinical advancements in the field of theranostics. Karolien, what about plenary 3 and 4?
So in the plenary 3 and 4, I think we're really looking into how nuclear medicine can really answer all questions that we may have. We hear a lot in the first plenaries about oncology. So in the other plenaries, there will be a lot of focus also on some topics that are not very general, like rheumatology, psychiatry, and so on, where we will see how nuclear medicine can also help in answering questions that we may have in these kinds of patients. And then in the final plenary, really we're going to look into the future. What is the future of nuclear medicine? There will be topics on AI, on precision medicine, and this will also be the topic of the Marie Curie lecture that will be given during the plenary 4, which is really one of the highlights of the Congress every year, and I'm really looking forward to that lecture also this year.
So Karolien already indicated, in addition to the plenaries, we will have a lot of exciting science. We are trying to summarize some of the most important topics, and given the bias that Karolien and me, we're both very active in oncology, we will actually focus on Sunday on neuroendocrine tumors, on Monday on prostate cancer, and on Tuesday on neuroendocrine tumors and prostate cancer.
So come back to this channel every day, come have a look at what we thought was great during the day of Congress. Also come and have a look at what we think is great for the next day. So if you are in doubt, because there's so many great sessions, you may take some clues from us from what is great in oncology. We hope you all have a fantastic EANM 2024. We're very much looking forward to the conference itself, to meeting all of you, to seeing friends again. So please have a great conference, and we say goodbye for now and hope to see you again tomorrow.
Thank you, Karolien. As both of us are actually social media nomads, we really ask you to not only watch it, but also share it. See you tomorrow.